Let us go to interviewing. The topic is types of pain and their pathology. So here we will look at the type of pain and its characteristics and what pattern it is. So if the pain is soreness, that's a dull ache that usually occurs in the forelimbs or trunk. That is a pattern of deficiency condition or dampness. When the pain is with feeling of heaviness, it will be a dull ache accompanied by a sensation of heaviness. This usually occurs in the limbs, head, or the whole body, and that is a pattern of dampness or phlegm. When the pain is distending or there's bloating, it will be a subjective bloating sensation. Bloating may also be felt on palpation when the area feels distended like a balloon and seen on observation, and that is Qi stagnation. When there is pain with feeling of fullness, the patient will feel very full as if after a heavy meal, perhaps also with a slight nausea, and the area feels hard rather than distended on palpation. Fullness cannot be seen on observation, and that is a pattern of dampness. When the pain is an ache with feeling of emptiness that often occurs in the head, that is Qi and blood deficiency or kidney deficiency. When there's pain with the feeling of cold, it will be a sharp or stabbing or spastic pain that is clearly accompanied by a pronounced feeling of cold or even shivering, and that is alleviated by the application of heat. That pattern is full or empty cold and usually in abdomen or limbs. When there is burning pain, it's a pain with a burning sensation. That's a pattern of full or empty heat, usually in the epigastrium or in the limbs. The next type of pain is colicky pain. That's a sharp pain of the colic or cramping nature. The pattern is cold in the intestines, blood stasis, usually in the epigastrium, or more usually the lower abdomen. When there is spastic pain, that's a sharp pain accompanied by spasms or contractions or a sensation of spasms, which is a pattern of liver blood deficiency in conjunction with liver Qi stagnation or liver yang rising, usually in the limbs or head, and is related to the sinews. And therefore, the liver, either of a full nature or a combination of deficiency of liver blood and fullness of stagnation of Qi. The next type of pain is dull ache, which is a very mild pain. It's usually a deficiency of usually chronic of long duration pain. Next is pain with distressing feeling. That's a pain accompanied by a restless and undefined anxious feeling and perhaps palpitations, usually in the epigastrium or chest. That's a pattern of retention of phlegm in the epigastrium affecting the heart and rebellious Qi in the penetrating vessel. Next is pain with a sensation of stuffiness. It's a pain with a mild feeling of fullness while the abdomen feels soft on palpation, usually in epigastrium or the chest. That's a deficiency of the spleen and fullness of heat or phlegm. Now, next is the pushing pain. That's a sharp pain accompanied by a feeling as if something was pushing the area, usually in the hypochondrium or epigastrium, and that is a severe Qi stagnation. Next is pulling pain. Pulling pain is a sharp pain accompanied as if the skin were being pulled, usually on the head, and that is a pattern of liver wind. Next is cutting pain, which is a very sharp pain that feels like a knife, usually in the lower abdomen. That's blood stasis and definitely full in nature. The next type of pain is throbbing. That throbbing pain is a severe pain. It feels as if there was a throbbing or pulsation, usually on the head, very common in headaches from liver yang rising. Next is the boring pain. It feels like the stabbing of the tip of a knife blade, a nail, or a screw. It is fixed in its location and usually in the lower abdomen, epigastrium, hypochondrium, chest, or head. That is a pattern of blood stasis that is full in nature. Next is lurking pain. That is pain that is not severe, not acute, relatively easy to endure, but chronic and persistent. In Chinese called yin tang, which means latent, hidden, or lurking pain, usually improves with the application of heat, generally in the abdomen or lower back. That's a pattern of Qi and blood deficiency or empty cold in the interior, leading to malnourishment of the channels. Now let's look at the time of pain. When it is a daytime pain, it is usually due to a dysfunction of Qi or blood. When it is at night, it is due to a deficiency of yin or blood stasis. Intermittent pain is due to either qi deficiency or qi stagnation, and continuous pain is due to blood stasis. Thank you so much for your attention.